Hi, and once again, welcome to Off the Cuffs. I'm Bobby Kimbrough. Today we have Jim from Insight today with us. I want to welcome you to Off the Cuffs. I appreciate you being here.
Thank you, Sheriff. Good being here.
It's very interesting that you're coming. Your timing is almost spot on, so to speak. I say that because, 'tis the season where we are having a lot of things happening in our community.
Mm-hmm.
'Tis the season where people are going through a lot of emotional and mental changes,
Yes.
as well as a lot of overdosing.
Yes.
And so, before I go any further, first of all, welcome to the show. And I'd like for you to tell us who you are, tell us about Insight. I was about to speak out of my lane and start talking about Insight. I definitely don't know as well as you know it, the services, but I want you to introduce yourself to our viewers as well as our listeners. Tell us who you are, where you're from, how you got here.
Sure. Okay, and I'm Jim Harner, and right now I'm the CEO of Insight Human Services.
Wow.
And Insight, we're in about 50 counties in North Carolina. Our specialty is working with people with substance use disorders, and we have three major components of the services that we offer. The one is prevention. We're in about 13 counties where we work with the community and the schools to develop community coalitions, working with youth and trying to prevent substance use, misuse, teaching them skills and better living skills and getting along with people without the use of substances. And then we have an intervention program, which is in about 47 counties. And those counties those programs are with TASK, which is Treatment Alternatives for Safer Communities, where we work with intermediate offenders that are on probation with a substance use disorder, and we provide assessments and we link them to treatment. We match them to appropriate treatment, and then we continue to monitor and provide case management with the probation officers to try to make sure that people get the treatment that they need. And then and we also do a recidivism reduction services,
Right.
which is treatment counseling services, where we work with people who are on probation, where we have an evidence-based programming that's really looking at the criminogenic thinking along with the substance use component going on. We're matching that together and trying to reduce recidivism when substance use or misuse has been involved in the criminal behavior.
So when you say human services, I heard you touch on counseling. So you do counseling there?
Yes, we do counseling. And then in our treatment programs, we do the counseling. We also do medication-assisted treatment, so people who are dependent.
So Insight is a drug treatment facility?
Yes, we are. Yes.
Okay.
Yes. And that's our third component, the drug treatment facilities. And here in Winston-Salem, we're on 4th Street, and we provide medication-assisted treatment, both we provide methadone as well as buprenorphine and naltrexone.
Wow.
So it's we work with people from all walks of life.
So I heard you say something in reference to you partner with students?
Yeah, in our prevention program, which is in a number of different counties, we have prevention.
Is it in Forsyth?
Yes, it is in Forsyth. And what we do is we work with folks that with the schools, and when youth are identified maybe at risk of possible substance use or behavior issues, then what we can do is provide a screening services and, if needed, counseling services for them. We work in conjunction with the school system on that. We also provide prevention services. We have a SAFE program, which is a education program, working with youth and their families. So we have the parents and the youth in there together, and we get the families trying to communicate about substance use that may be going on. Sometimes a child in adolescence, that's when a lot of times the problems begin as far as substance use. And they may just be experimenting. No big problems or anything in the family necessarily or anything. The friends are doing it, so they try to experiment. Well, if that gets identified, then what we try to do is talk to them and get the family involved and get that communication going to get the support systems in place so that the youth can make a positive decision and not to use drugs or alcohol.
So about how many people do you see? How many clients do you see on a weekly basis, a daily basis?
Okay. You
said 5 counties you see, right?
Right. And in Forsyth County, here in our treatment program, we have about probably 300 to 350 people a day come through our treatment program on 4th Street.
Wow.
Yes, and then in the prevention programs.
So when you say come through a day in
Yes.
your treatment facility, they come through for counseling. They come through for what other services would they come through for?
Right, sure. They come for counseling. They also come for medication. So when I talked about our methadone program, in order to get that medication, they have to come every day, and they have to see a nurse, and the nurse watches them take it. So they don't leave the premises with that medication until they've been able to show a period of stability. And we know that the risk of any diversion, if they take home some medication, that risk is low. So a lot of people come in every day, and they see a nurse. They may see their counselors. We have counseling program where people may be coming 5 days a week. Some people for counseling, some may come 3 days a week, some may come once a week, and some may come only once a month. Those people that are very stable will come maybe once a month, and they'll come in and get medication a couple times a month. And
so,
depending on how their recovery's going.
So do you operate 5 days a week, 6, 7, what day? How many days a week?
Our counseling is available 5 days a week, but our medication program is open 7 days a week.
Wow.
Yes.
You know, I have to tell you a story about your facility.
Okay.
So several years ago, I was going to speak at the Friends Academy in Greensboro. I think that's the name of the school. And that morning, as I was getting ready to leave, I said, you know, how wonderful it would be, or how strong or impactful the message would be. If I could find someone to share their story, their struggle, their transformation.
Mm-hmm.
And I'll never forget, I stopped in at your place, and I walked in, and I told the lady who I was. At the time, I was an agent, and I told her that I was looking for someone and they told me due to confidentiality, they couldn't discuss anything with me, nor could they refer anyone to me. So I'll never forget, I went and stood outside and was talking to a client of you all's, and myself and another female partner that was with me talked with the lady, and she said, I would love to tell my story. It's therapeutic for me telling my story.
Okay.
So she rode with us to the site where we were speaking. Not only did she tell her story, how impactful she was about the changes she had been through, her story on narcotics and opioids. She talked about how her life had been transformed by coming to your services, receiving counseling, and trying to basically get her life together, and how instrumental you all have been. And I said, I had no idea that you all did that kind of work or the services you provided. She gave me not only a Reader's Digest version, she gave me an in-depth version of what you do there. And so show you how things come full circle. So years later, while I was on the campaign trail and I was trying to gather as much information as I could about the type of issues that we had in this county. I knew the issues we had nationwide, but I want to know exactly the issues that we had in this county. And so I stopped by there and met with, I can't think of the name of the lady at the front desk, and she referred me to a counselor that you had on the net. I may have
Annette.
Exactly.
Yes, Annette. Yeah.
And she was kind enough to talk with me and share with me vaguely what you all did and the services that you provided. And I never forgot that. And then about 2 months ago, I was coming through downtown and I saw the number of people out there that was waiting for services. That night, I went on an overdose call, and it hit home with me so hard. It really hit home with me so hard that the need for services like the one that you oversee, that people need to know the service that you provide, the level of service, and the variety that you provide. And so I said, I've got to get him on, because
Right.
on this podcast, what we try to do is bring people and conversations that are relevant
Mm-hmm.
to the table. You know, a lot of times we got so much going on in our community, in our county.
Sure.
One of the things that we fail to do is talk. You know, let's
Mm-hmm.
talk about
Sure.
some things. Let's share. Let's bring our
Right.
different silos to one table
Mm-hmm.
and make it known what we have in this community that is available, because we're losing too many lives. I saw the Truth commercial. I don't know if you've been seeing those that are
Mm-hmm.
popping up.
I've seen some of them, yes.
They're just so powerful.
They are.
A young lady is a valedictorian, and they're congratulating her for being a valedictorian. And as she stands up and takes the mic and she says, I want to thank you all for this moment today. She says, but I must share with you, 5 years from now, I will have hurt myself. I will become addicted to opioids. And she went on, and the commercial was so impactful that, and it reminded me and it made me think about the people that I see some days standing out there were very influential people. They were decision makers in various communities and in their lives, and how years later their lives took a turn, whether they were became addicted. It only takes, 5 days or something
Right.
to
Very short time.
to become
Right.
addicted to an opioid, whether you
Sure.
prescribed it for a leg break or any type of thing.
Right.
And I've always been just, how do we slow the numbers? I know we'll never stop them. I know that. I'm not that naive. But how do we stop them, you know, from last year losing over 70-something thousand people
Right.
to opioid deaths? How do we stop this? And I think that one of the things that we stop it is by bringing attention, by bringing people like yourself in to talk about the services, to talk about the numbers that are out there. And also we have to remove this stigma from it.
Yes, we do. I was getting ready to say that's one of the biggest things is the stigma. You know, so many of our folks, they won't reach out and get the help because they're afraid of what other people will think of them. You know, instead of realizing that addiction affects almost all of us. You know, if it's not ourselves, then it's someone in our family.
Explain
Most
that.
people.
I understand that, but so many people don't understand what you just said. You just said addiction affects
all of us.
all of us. Explain that, because so many people think that it didn't happen in my house, so
Right.
it's not my problem. Explain that, because I understand it, but I want people to hear it from a different perspective.
Right. Well, I think if we just think about it, that so often the headlines are the opioid addiction, but also you think of alcohol addiction, other drug addictions. You know, more people die in the U.S. of alcohol-related illnesses than opioid use disorder. But yet that seems to be more accepted in our communities. But to realize that if we stop and we think about family members or friends, maybe not in our immediate family, but probably one in you know, about a quarter of us maybe probably have someone in our immediate family that's been impacted by addiction, that they've struggled with it themselves. But most of us, even in our extended family or our friends, someone has struggled with an addiction. And I was thinking, I was talking with a friend the other day about some difficulties his father had. And I remember a conversation I had with this gentleman a number of years ago when he was just asking me a question that at the time I didn't pick up on, that really what he was doing was reaching out for help and saying, you know, I just drink a beer or two after work here now and then. You know, it's really not a problem, is it? But now he's got to go to court because his drinking had progressed out of hand. And so it's those things that we don't pick up on, but it does affect us. Little bit of misuse can develop into more and more. One of the programs we had the privilege to be involved in a few years ago was an SBIRT program, which is Screening, Brief Intervention, and Referral to Treatment.
What's the name of the program again?
SBIRT.
SBIRT,
Yes,
okay.
Screening, Brief Intervention, and Referral to Treatment. And it's something that the SAMHSA, the Substance Abuse Mental Health Services Administration, is really supporting, and they're finding nationwide. And what it is, it's getting that screening process in place in doctors' offices and in emergency rooms. and we worked with folks at Wake Forest Baptist, their trauma unit. They shared what they were doing, as that's a part of their trauma unit. But now it's becoming something that's commonplace in most of our doctors' offices. So now when you go in, they ask, your medical history. They may ask, do you smoke cigarettes? Do you wear a seatbelt? How many drinks of alcohol do you do? And what they're looking at, and one of the things we found is that we see drinking as or substance use as either a problem or it's not a problem. Mm-hmm. Instead of thinking of it more as a continuum, and look at it that even some misuse beginning early on can lead eventually to a bigger issue, a bigger problem that can affect our lives without us even realizing it. And it happens slowly over time. Sometimes it's very quickly. Sometimes it takes longer. And as Dr. Norma Volkoff with National Institute of Health, she calls it a disease of the will. Kind of the idea is that the substance use that we take, and it could be even we go to the doctor to get some medication because we've had surgery, right, or as you mentioned, a broken leg or something. But what that medication can do, even though we're taking it as prescribed, it affects our ability to think and to reason, and to be able to plan ahead and to see the consequences of what this continued use would do. And so then it helps alleviate some of the pain that we're having. So we think, well, maybe a couple would help, or maybe 3 would help. And before we know it, it alters our brain chemistry and our brain function so that we're not able to think clearly. And so our family and friends may say, I see this happening to you, but the person using or misusing the substances may not see it happen. And so it's something that can be very subtle, but then when it finally hits us, seems like everybody can see it, but the person engaged in the substance misuse may not even understand that that's what's happening.
That's so true. The people in my close circle have heard me tell this story before, but several years ago I had a total knee replacement. And they prescribed me, I want to say, hydrocodone. It was some real funky stuff, so
sure,
to speak, and because of the pain. And I'll never forget, I took one, and it was so good, so to speak. I felt so good that when I woke up, I wet myself, right? Mm-hmm. Probably shouldn't have said that, right? Mm-hmm. It put me in such a deep sleep, right? Mm-hmm. And I'll never forget saying, I don't want nothing that strong that puts me in a deeper sleep. So, of course, I stopped taking them. And I cried my way through the recovery.
Sure. That's
because
painful.
I refused to take the pain pills.
Right.
I just stopped. And so I understand how someone can become addicted to a prescription that was prescribed to them, because that frightened me so bad that something made me feel that way. And it was prescribed to me by my doctor, who did the knee replacement. And so something that made me feel so warm and so fuzzy, but yet I forgot to go to I said, I don't never want to feel nothing that good before, nothing. And so I stopped. And so now, of course, I've had shoulder surgery since then. And I said, I'll be all right. I'll just fight through the pain, cry through it,
sure, whatever,
take Tylenol or something, ibuprofen, whatever.
Right.
But so when I see people, I know that they didn't wake up that morning wanting to be addicted to that.
Right.
No one starts their life saying, hey, I want to be an addict.
Sure, they
don't.
No
one doesn't do that.
No, they don't.
And so I think that we've got to remove the stigma from it. That's someone else's problem, because I'm just a firm believer that there is enough resources in this area, in this country, to make more of a dent than what we're making in it. Because I try to respond if I'm in my car and I hear the call come out. I respond to the cold whites, the overdoses, things like that, because for several reasons. I respond because I want the family to know that they have our support.
Mm-hmm.
And I just believe that people need to know that they're not in this alone.
Mm-hmm.
You know, we do the Never Walk Alone.
Right.
Every year we do that
Mm-hmm.
at Courtney Plaza because we've got to bring attention to it.
Yeah.
And I'm so grateful that you are there. And you have once again shed a light on a subject and a facility, an entity that I knew something about, but you've given me something else to work with. So, going back, you and I were talking before we came online. You were talking about you're from Vermont, right? And
Yes.
I heard you say that, if my memory's correct, you said that you got your formal training at Duke.
Yes.
Won't hold that against you.
All right.
We in Wake Forest country.
I understand.
We won't hold that against you.
No.
But
Yes.
so, when I have guests that come and sit in front of me, I'm always sizing them up. I guess I
Sure.
go back to Quantico. I'm sizing them up, and I'm saying to myself, I'm looking at you and I'm thinking, I'm saying, it takes a special kind of person to do what you do. It takes special people to say, I'm going to counsel someone through their
Mm-hmm.
through their midnights,
Mm-hmm.
the difficult times in life. I'm going to try to be a servant. I'm going to help them.
Mm-hmm.
What drove you to wanting to be a part of helping? What drove you to Insight? I mean, was it just a job?
Sure.
You needed a job?
No, it wasn't that. I think it actually begins in that I grew up and my family was affected by addiction. Okay, I watched my father. He struggled. He was in recovery, but his health was declining at an early age because of his prior history of addiction. And I really didn't think about it that much until later on. But I had a desire just to be with people, not necessarily to fix them, but just I enjoy being with people. And so I got into some studies into counseling, and then I was got into the ministry, actually. And then when I found in the ministry, I found that a lot of the folks I worked with, I was doing a lot of counseling. Counseling with people who were struggling with addictions, struggling with domestic violence, struggling with mental health disorders as well. And so then I focused more on the counseling piece. And so now I've been doing counseling, programming in behavioral health, both mental health and substance abuse counseling, for probably the past 30 years or so. And always working with the folks that are funded through the public sector. Okay, I haven't been in private practice. I guess my heart is for those who are who really are maybe have gotten to that point where they've got nowhere else to go.
In complete transparency,
sure.
No one told me that, but I knew that somebody close to you or somebody that you love had been affected by
Sure.
that. And I tell you that because not my father, but someone that I love was affected by opioids. And so I can sense the passion in you when you talk about it. I can sense the passion in you about this topic, about this issue, because when I talk about it, I have the same passion. So I knew the answer to the question before I asked you. I just wanted you to tell me what I already knew. But I applaud you for that, because I think that it's the passion that drives it. You have to be passionate about saving lives. You have to be passionate about the number one what I'm called crisis that we've had, epidemic. The number one epidemic in the history of America is the opioid epidemic. That's just not me saying, that's the CDC saying that.
Sure.
And so we have to, I guess we've got to have more passion and compassion. We've got to have more hands on deck to fight this issue, because I think we have taken a stance of acceptance, where, it's almost like we hear the overdose, we hear them so much that we become immune to the urgency. Right. And I think that you said something I want to go back to and segue into it as we start to exit, and that was you said something about the schools. Right. And so the question I have for you is this: if you think back over the years that you have been in the counseling profession, right, in the industry that you're in, have you seen a younger age of the people that are being affected, that are coming in for services? In other words, are the clients and the people you serve younger, getting younger than what they used to be? And I say that because I've witnessed people as young as 15 and 16 years old.
Mm-hmm.
You know, years ago when I had, you know, I'm in my 50s
Mm-hmm.
at the back end, as a matter of fact.
Okay.
And, you know, when you talked about an addict, it was usually an older guy. It was
Right.
usually somebody
Right.
older. But now you're seeing them at high schools.
Right. Yeah, and it's it's always been there, I think, even probably similar to the same age in the latter half of the 50s.
Mm-hmm.
But I can remember when I was in school, it was there, but you didn't hear about it as much, and maybe not as many as of the overdoses, especially with the opioid use. And you know, it's something as we've been talking here, I've been thinking, I think part of the passion is seeing the miracles when people get into recovery,
Like that.
where you see that people have struggled and substances have really destroyed their lives, but people who are able to overcome that. And that's really what keeps me in this, is seeing the work that people do and the miracles that happen in their lives. And it's just a joy to be a part of that. And I think when I see young people, and I've had to go visit and assess young people in the hospitals, you know, teenagers, 15 years old with pancreatitis because of too much drinking, things like that. And I just think of that Truth commercial you mentioned, of that valedictorian that's telling her future.
Right.
And I see these young people where that's happening. And if anything we can do to prevent that, where that we can really encourage them to hold on to their strengths and to avoid the things that can really hinder their lives. They have so much potential. And it's really, I tell folks this, and I tell my counselors when I'm supervising them, I'm saying we're not so much into just making people feel good. We're in the business of trying to keep people alive. It's about making sure that people are alive. And that's part of my passion, and even with young people that are, even when they're younger. And I want to thank you for your department and all your work that you do. I've had conversations. My wife's cousin, he's been in law enforcement. He's now retired. But we talked about the difference between a law enforcement officer and a counselor. Mm-hmm. And we came to the conclusion that we're both in it for the same reason.
Right.
We're there to help people.
Save lives.
Right, save lives. We have different ways in which, or different techniques that we use, but we're joining together, and we're both trying to work together, and that's what I really appreciate about your department.
So where are you located at?
Right. We're at 665 West 4th Street here in downtown Winston-Salem.
665?
West 4th Street.
West 4th Street.
Yes, sir. Yeah.
Yeah, you're right there near the Winston-Salem Foundation, right?
Yes, we are. Yes.
Yeah, you're right across from where the old modern Chevrolet used to be.
Yes, yes. Yeah, there's a parking deck there now. Yes,
exactly.
Sir. Right.
Yeah. So tell me, is there a phone number? Let's say someone's trying to reach you. Or what's the phone number?
Sure. Someone wants to reach us, they can call our main number at 336-725-8389.
725-8389.
Yes, that's it.
725-8389.
Yes, sir.
8389. 725-8389.
You got it.
Well, you know what? I want you to know that I appreciate you stopping by today.
Okay.
I appreciate you talking about a subject that is relevant, a subject that needs all the attention that we can bring to bear on it, because at the end of the day, like you just said, it's an epidemic that is affecting all of us, not just 1, 2, 3, or 4. It's affecting our total community. If it's nothing but in the NIC unit, babies born.
Right.
If it's nothing but how it affects crime, breaking and entering. If it's nothing but people dying. It's a life thing. It's not a black thing. It's not a white thing. It's not a partisan thing.
It affects all of us.
It affects all of us. It's a life thing. And I want to thank you for being in the business of saving lives. If there's ever anything that the Forsyth County Sheriff's Office, the Office of the People, can do, please stop by anytime. And I appreciate what you do.
And same here.
Thank you,
sir.
by.
Thank you.
Yeah, because I appreciate what you're doing.